Hello, it's Dr. Haddad, the Chief of Staff of Water Health. I hope you're enjoying the summer. I know it's been a tough spring. Fortunately, over the past couple of months, we haven't had any COVID-19 patients at the hospital, in our ICU or the medical floors. And I have to be honest, I completely credit this to the fact that everyone out there in the community has done their best to bend the curve, crush the curve, and reduce the number of patients, number of cases within the community itself, both in the county and the whole province and the country as a whole. Of course, not having patients at the hospital is a reflection of the fact that we have less prevalence in the community currently, and hopefully we'll keep it this way. As you know, the weather will cool down next couple of months, and people will move indoor again. So it's more of a reason to maintain our vigilance and continue to follow public health directions and advice about physical distancing, hand washing, and using masks indoors, etc. We are keeping an eye on things, especially as the schools reopen and the weather gets colder again. The common cold and flu season will be coming again, and it could be a bit of a challenge to discern who has COVID versus influenza versus anything else, as the symptoms are basically all the same: cough, short of breath, fever, etc. Nevertheless, from a hospital standpoint, we are ready to deal with a potential second wave, albeit we hope we don't get one. I'm hoping actually that the influenza season would not be as bad as last year, even though it could, but I'm hoping it won't be for a couple of reasons. One is that influenza spreads just like COVID-19. And if we continue to follow public health measures to reduce COVID-19 spread, that will also translate to reducing influenza spread as well. The experience in Australia is that they don't have a lot of influenza, even though they are struggling with COVID-19 still. Having said this, I really encourage everyone to take the influenza vaccine, regardless of their age group. And that will help to increase our coverage and protection as a community as well from influenza. Even if influenza vaccine is not 100% effective, depending on the strains we have every year, but even if we have 40, 50, 60% efficacy, that's still good. We have noticed a shift in demographics of patients getting COVID-19 from older patients in March and April, many of whom got really sick, and as you know, many got admitted to the hospital. Some ended up with us in the ICU. Few survived, few didn't make it, unfortunately. But nevertheless, the shift has been basically into younger people getting the virus more now. And I think that's mostly due to COVID fatigue and people just getting tired of it. And there's more socialization now as we enter phase 3. And occasionally letting our guards down. We still have to be careful. The problem with the virus spreading or circulating among our young is that they don't get as sick, which is good, but at the same time it can be silent or asymptomatic, and then therefore they can transmit it to other people, especially their parents or grandparents. So we have to keep an eye on that. The latest data seem to suggest that the asymptomatic spread or asymptomatic phase of the virus, where someone is still infectious, is roughly between 20 and 30%. I've seen it as low as 8% and as high as 70%, but mostly it seems to be 20 to 30% based on some of the epidemiological data that we're seeing in different places in the world. Let's continue to do our best so we don't see anyone back at the hospital with COVID-19, especially in our ICU. Nevertheless, rest assured that as your county's hospital, we are ready for a second wave of COVID-19 or actually any other respiratory illness. We've been at the forefront and the forefront of therapies for COVID-19 up to date pretty much all the way from the beginning of March. Nevertheless, I hope that no one gets it, and please help us by continuing to follow all these public health measures to maintain a low prevalence in the community, which actually is what will protect our schools and our businesses and our households as well. So in the meantime, please continue to enjoy this summer, and we'll see how September goes. Thank you.